Mental Health Conditions and Substance Use Disorders Policy Presentation by Michelle Rosenbaum, Analysis of Social Service Policy, Social Work 5218, taught by Dr. Lauren Alzondo through the University of West Florida. Throughout this presentation, we're going to learn about mental health conditions and substance use disorders. We will define these terms, we'll look at how many people are impacted by these terms, and how are the people impacted by these conditions. Additionally, we're going to look at policies regarding mental health conditions and substance use disorders. We're going to look at the impact of those policies and ways we can improve those policies. What is mental health? According to World Health Organization in 2022, mental health is defined as our state of mental, emotional, and psychological well-being. Mental health conditions are defined as a condition that is causing significant impact on an individual's life and ability to function. This definition came from the article Mental Health and Mental Illness Defined, published by NAMI. According to the National Alliance of Mental Illness, or NAMI, in 2023, the most commonly diagnosed mental health conditions in American adults are anxiety disorders, major depressive disorders, substance use disorders, post-traumatic stress disorder, and bipolar disorder. While understanding the statistics of the diagnoses, it is also important to remember that upwards of 50% of individuals with mental health conditions often go undiagnosed. Substances are defined as the following. According to the Centers for Disease Control and Prevention in 2022, substances are defined as anything absorbed by the body resulting in possible dependence or other undesired effects. Common substances linked to substance abuse are alcohol, marijuana, misuse of prescription medication, methamphetamines, cocaine, opiates, hallucinogens, nicotine, and/or inhalants, according to Johns Hopkins Medicine 2024. Substance use is when an individual can use a substance as defined in a controlled and socially acceptable and safe manner. Examples of this could be having a glass of wine after a long day at work occasionally, or taking a painkiller as prescribed after surgery. Substance use disorder is when an individual is unable to control their use of substances, and it impacts the safety of themselves and/or the safety of others, and their ability to function. Substance use disorder is classified as a type of mental health condition. Beyond this slide, I'm not going to talk too much about co-occurring disorders. However, I do think it's important to mention. Co-occurring disorders is the combination of a mental illness or mental health condition and a substance use disorder. In 2022, approximately 21.5 million United States adults had a co-occurring disorder. Some of the most common co-occurring diagnoses are substance use disorder along with anxiety, depression, post-traumatic stress disorder, psychotic disorders, borderline and antisocial personality disorders. According to the Substance Abuse and Mental Health Service Administration's 2022 National Survey on Drug Use and Health, approximately 23.1 or 59.3 million adults had some sort of formally diagnosed mental health condition in the last year. Adults between the ages of 18 to 25 had the highest rate of mental health conditions compared to any other age group. Of those between the ages of 18 to 25, 36.2 or 12.6 million adults had a mental health condition. Additionally, 59.8% or 168.7 million people ages 12 and over had used some sort of tobacco, nicotine, alcohol, or illicit drug in the previous month. Of the 59% who have used a substance in the last month, 17.3% of those people had been diagnosed with a substance use disorder. Considering how many Americans suffer with mental health conditions and/or substance use disorders, I decided to take a look at how much these disorders are estimated to cost Americans every year. According to Cummings in 2024, it is estimated that the United States spends roughly $282 billion every year on mental health costs. There was one study completed in Indiana that estimates untreated mental illness costs the state approximately $4.2 billion a year, with $708 million in indirect healthcare costs. One thing I did find interesting was, according to Gateway Foundation, the cost of substance use disorder across the United States is almost 3 to 4 times as much as the cost of mental health conditions. The Gateway Foundation stated that substance use disorders cost the country roughly $820 billion a year. Of the $820 billion, approximately $120 billion are due to lost productivity, $61 billion are related to criminal justice, and just over $11 billion are related to healthcare costs. Mental health conditions can impact people in countless ways. Some people struggle to take care of themselves, resulting in poor hygiene, poor nutritional intake, as well as poor mental and physical caring for themselves. While some individuals are able to physically take care of themselves, they struggle to maintain a job. This can result in limited income, which can make it challenging to buy food, pay rent, which can lead to being unhoused and/or poverty. Some mental health conditions can lead to bizarre and/or unsafe behaviors, which can result in criminal justice system being involved. While working on an inpatient psych unit, we had one patient who was a treatment-resistant schizophrenic. He had a long history of inpatient admissions, however, would often lack the follow-up care due to his disorganized mental state at baseline. His most recent admission was due to him throwing a brick through a fast food restaurant window at an employee because the voices in his head told him the employee was hoarding all of the Diet Coke. The police became involved, and eventually he was deemed incompetent to stand trial and the charges were dropped. However, this is his baseline. Even on medication, he is still an extremely disorganized person. Substance use disorders can impact people in just as many ways as mental health conditions. Some individuals are able to hold a job and maintain relationships, but maybe not at the same level of effectiveness prior to their substance use. Other people may end up losing their job due to having failed drug tests, missing work too many times, being intoxicated or under the influence while on the job, which can also impact other areas of their life and have that domino effect. It can also result in physiological changes to your body and the physiological chemistry in your brain. Now that we have a better understanding of what mental health conditions and substance use disorders are, we're going to talk about the current policies in regarding to mental health conditions and substance use disorders. When looking at mental health and substance use policies, there are so many policies that come to mind. However, for the purposes of this presentation, I'm going to focus on the legalization of recreational marijuana in the state of Maryland for adults ages 21 years and older, effective July 1, 2023. In 2023, Governor Wes Moore legalized the use of recreational marijuana. On a macro and meso level, the taxes associated with the legalization have brought in over $40 million to the Community Reinvestment and Repair Fund, which focuses on rebuilding the communities that were most impacted by the criminalization of marijuana. Additionally, Governor Moore did pardon 175,000 cannabis-related charges, but the communities are still impacted in a negative way. Decriminalizing cannabis and cannabis-related charges does allow law enforcement officers to focus on more violent crimes. However, some people do not feel that the decriminalization has drastically made impacts. On a micro level, cannabis use has been linked to increased feelings of anxiety, depression, and increased risk of schizophrenia and other psychotic disorders. The National Institute of Health released a study in 2023 stating that approximately 30% of schizophrenic men aged 21 to 30 years old could have prevented their illness by not using marijuana. This is extremely impactful, as roughly 50% of patients at a psychiatric facility have schizophrenia. While the decriminalization and pardons of cannabis-related behaviors has been impactful and helped rebuild communities in the Maryland area, we need to know more about how marijuana impacts the body and the brain. At this point, we have some research, but not a ton. We also need to increase how often and the ways that we are screening for substance use disorders. Approximately 10% of adults who use cannabis will become addicted, and 16% of people that use cannabis under 18 years old will become addicted. While there is still extensive violence relating to marijuana, homicide rates in the state of Maryland have somewhat decreased since this legislation.